Hi, today we're going to be learning about IV catheterization. First, we need to make sure we have all the supplies we need for this procedure. We need a needle, the IV extender, normal saline flush, a tourniquet, the tegaderm, alcohol prep pads, tape, and a pair of gloves. Make sure that your hands are sanitized before initiating any procedure. So first we're going to prep the needle. IV extender, normal saline, you have the tourniquet and the tetra. Also make sure you have 3 pieces of tape pre-cut at about 3 to 4 inches. That's going to be used at the end. Okay. So make sure you have correct patient identification, that they are not allergic to latex, and if they have any contraindications to IV line placement. Now we're going to flush the IV extender with a normal saline. Okay. I'm going to put the gloves on. And place the tourniquet. You're going to inspect for the veins that are best for cannulation. Now we're going to clean, prep the area with an alcohol swab. We're going to disinfect in a clockwise fashion, starting on smaller circles, then widening the area. Make sure you do not touch the area after it has been sanitized. Okay. Now we're going to put the injection. Needs to have the bevel up and insert it at a 30 to 45 degree angle with pressure. Okay. After it is about halfway, lower the angle to about 10 degrees. Okay. Advance the catheter and remove the needle. Put pressure. Okay. You're going to dispose of the needle in the appropriate container. Okay. You're going to remove the tourniquet and place the IV extender. Okay. Make sure there's backflow of blood. Then push the normal saline. Okay. Lock. And then we're going to change the normal saline and place the lock. Okay. I'm going to place the tegaderm. Okay. And then the tapes in a horseshoe manner. And that is IV catheterization.